bottom line is these are two patients. I want to show you that contrary to what's our expectations and what we've been told, lifestyle changes does work. These are two patients of mine. You can say they're anecdotal. They're both end-stage heart failure. One is end-stage heart failure with preserved ejection fraction. 74 years old, cabbage, normal heart function, coronary disease, already with type 2 diabetes with hemoglobin A1C of 9. At goal with our statin therapy, LDL 55. Admitted in the hospital with diuresis 60 pounds. Then I tried to put him on what he called rabbit food diet to rescue. He didn't want to agree. 3 months later, readmitted. We had to give him a stent in his lima to LAD. Eventually, he decided he's miserable enough. He's going to try to take my offer. All right. Then the other one is a younger woman that I've known for over 20 years that I noticed is non-ischemic cardiomyopathy, type 2 diabetes on 100 units of insulin a day since age 18. Declared type 1 diabetic. I saw her EF dropping from 45 over 20 years to 10-15s. She was so obese with a high BMI and with kidneys so advanced, CKD stage 4, that we could offer her to send her home a Mirena. And that's palliative, doesn't last long. And then I had the conversation with her. I called her on a Saturday. I said, do you really want to, let's work together. Everything you put in your mouth for the next, week, you take a picture first, you send to me, and then I tell you how to replace. All right. And she had a continuous glucose monitor. And then I replaced those meals little by little with things that she can easily do 10-15 minutes. By the way, it's not as expensive as you think. She lives off food stamps. This is not a high income person. It can be done. And within the first patient, after he adhered and we worked together, and basically all I did, I showed them how I eat, nothing else, nothing I haven't done. And again, I'm a busy person. I don't have much time to cook. The first patient dropped over 100 pounds. Okay. Kidney have normalized, still has proteinuria from diabetes. His diabetes has been cured. Hemoglobin A1C is 5.4. BMI is now down to 29 from 42. Triglycerides, which notice were 408. That was on top of Tricor, statins, and everything else. We took him off all that. He's still on statins, but his triglyceride is now 156, and the ratio now is 3.6. Remember, normal is 2.5 or less from a ratio of 13. He has been out of the hospital for the last 3 years. He walks easily 10,000 steps a day. He feels better than he felt in 15 years. No hospitalization since. The other one that I told you, end-stage non-ischemic cardiomyopathy, within 3 days, I had to take her off insulin. Within 3 days, after she's been for 22 years on over 100 units. Okay? Weight dropped gradually by 70 pounds. BMI got better. Hemoglobin A1C 5.7. 6 months later, she's cured from diabetes 2. It's reversed. BMI is down. Now, couldn't tolerate any medicine from my heart failure medicines. Now her ejection fraction has improved. Now she tolerates, she's on GDMT, like it's supposed to be goals of therapy. She walks, she only takes water pill once a week, and she walks 10,000 steps a day, couldn't do 20. The year we discussed this, she had 20 admissions in the hospital and was dying. Hasn't had one since then, 3 years. And she feels better. She couldn't walk 20 steps. So it's possible. Of course, this is not evidence-based. This is not large scale. Okay? But it can be done by just cleaning up the ultra-processed food. And guess what? These are some ugly statistics. In 24, we had almost 4,500 heart transplants, LVAD 2,500. Total patients living with heart failure reduced ejection fraction, 3.5 million. We helped, and we should continue to do that, 0.2% of this. What about how much we spend on GLP-1 receptor agonists? I'm talking about Mounjaro, I'm talking about Ozempic, 20 billion, the same amount of money, by the way. All right? Okay. There's a catch. The catch is that if you were to look at how many of us are metabolic healthy right now in the whole country, according to Dr. Mozaffarian at Tufts, okay, only 6.8% in this room right now are metabolically healthy, according to the stats, which means you have at least 3 out of 5 of these risk factors for metabolic syndrome that are present, that means 93% of us at whole country as adults are not metabolic healthy if you have at least 3 out of 5. This is the ugly statistics. This is not genes. This was not like this. It was less than 5%. Diabetes type 2 in 1970 were a rarity. It only occurred in people older than 65. This has nothing to do with the genes. Doesn't matter who says what it says. This is exposure. It doesn't matter how you turn it around. And exposure to something that never existed before in humans as we're exposed now. Okay? So that by itself tells you something.